Hi, welcome to the webinar ASHP Students and Advocacy, hosted by Policy and Legislative Advocacy Advisory Group. My name is Carly Redlick. I'm currently a P4 at the University of Kansas School of Pharmacy, and I'm pleased to serve as one of the speakers today. I'm going to be speaking along with 4 other members of our Policy and Legislative Advocacy Advisory Group and our guest speaker, Dr. Melanie Dodd. So some of our objectives today, we're going to be talking about kind of the grassroots of advocacy. So Advocacy 101. We will also be talking about how students fit into that advocacy role and what ways they can get involved. We'll be talking about some key issues that ASHP has listed on their website and some opportunities that SSHP has to get involved with advocacy. Then we will have a discussion with Dr. Melanie Dodd and just go over a little bit of her experiences with advocacy and her career path and where she is now.
Hi, my name is Missy Dobby, and I am a P4 from the University of Florida College of Pharmacy. It is very important to take time to educate legislators and policymakers on an ongoing basis and clearly describe how the issues affect pharmacists, other constituents, and healthcare in general. It's very important for us to educate our legislators and congresspersons with our respective locations through personal visits at their office, phone calls, and even personal letters, postcards, or even emailing them letters to their offices. Speaking to your legislators is a great way to advocate, but to make an impact, you have to be prepared. Before you visit or call your local representatives, educate yourselves on effective methods to succeed. And we can do this by looking at the ASHP Advocacy and Issues website. They have a political activity toolkit for us that has information on how to build relationships with your legislative representatives, as well as voters' guides, and that way we can understand the issues that are relevant to pharmacy and hand those out to them. And then also have member spotlights on this website to show successful initiatives on sharing different ideas and how we can be more successful in educating our legislators. And so here is a look at the ASHP resource so that I mentioned on the previous slide, the Advocacy and Issues website. And so here they have different ways for us to learn how to educate our legislators. They have different tabs on their website, such as what's new, some key issues that we can speak about with our legislators, as well as to learn more about provider status.
Clicking on each of these key issues located on the ASHP website, as shown in the previous slide, will take you to links related to legislative, regulatory, and state advocacy. Here are some of the key issues at the moment that are listed on ASHP's website. 340B, compounding, drug pricing, drug shortages, healthcare reform, hospital reimbursement, medication safety, opioids, and more.
Hi, I'm Richie. I'm a P4 at the University of Mississippi. So as student pharmacists, it's important to realize that advocacy can be simple. Think about how you respond to the following questions on the slide. So when you're seeing a patient in an internal medicine clinic and the patient asks, are you a medical student? Or why would I need to see a pharmacist? Or seeing your family over the holiday break when you're home from school and at Thanksgiving dinner, they ask, why does it take 4 extra years of school to learn how to count pills? It's important to recognize that advocacy is not only on Capitol Hill, but that it starts before that. Developing an answer to each of these questions is a way to advocate for yourself and explain why a pharmacist is able and qualified to providing patient care. Professional advocacy means to promote your skills and education as a healthcare provider, and the goal in advocacy is to increase patients' awareness about our role in their health, and we want them to know who we are, what we do, and why we do it. Ultimately, our family members and the patients we care for are our voters, and pharmacists are credible to legislators, but also directly influence voters to support pharmacy initiatives. And so why is it important for student pharmacists to understand how and why we need to advocate for pharmacists? Creating student pharmacists can cultivate active professionals who will shape this profession in the future, and through our advocacy efforts, we have the ability to shape the profession that we'll be entering. One way to explore this initiative is possibly hosting a roundtable event at your school to discuss these issues with other students and faculty members. This can be a great way to get more students engaged in advocacy and find an issue that they're passionate about. Other ways include keeping up with current pharmacy issues, participating in state level, school level, and nationwide initiatives, and be able to speak up when the opportunity arises.
Troy Lenifing, and I'm a fourth-year pharmacy student at the University of New Mexico. Here, I'd like to talk about advancing our profession, specifically when it comes to provider status. Achieving provider status is about giving patients access to the valuable care that you provide. Becoming a provider in the Social Security Act means that pharmacists can participate in Part B of the Medicare program and bill Medicare for services that are allowed under their scope of practice. 3 aspects of provider status include: first, a state-by-state definition of what a provider is and if a pharmacist satisfies this definition. Secondly, what a pharmacist's scope of practice is within that state, such as what pharmacists can legally do. And third, how pharmacists can be paid for their services. If you're interested, you can find information about the 2020 approach to provider status at ashp.org/advocacy and issues. ASHP is starting in 2020 by working with other state and national pharmacy organizations to ask CMS to eliminate barriers to pharmacists practicing at the top of their licenses. In particular, we are highlighting pharmacists' role in patient care and asking for CMS to align Medicare supervision and payment rules with the most robust pharmacist state scopes of practice. Secondly, another way to advocate for your profession is through the clinician status. Here's a table of 4 different states that are currently approved to be pharmacist clinicians, or advanced practice pharmacists, or clinical practice pharmacists. These states have a variety of characteristics and requirements for their pharmacists to have prescriptive authority. If you are interested in learning more about this, please visit different states' Board of Pharmacy websites and their requirements and advocate for pharmacist clinicians in your state.
Hi, my name is Carrie Rao, and I'm a P4 at Northeast Ohio Medical University College of Pharmacy. So there are many opportunities available for students to pursue with their SSHP chapter at their school. For example, getting involved with state affiliates and representatives and participating in Student Legislative Day are great opportunities that help increase student involvement in pharmacy advocacy. So at this event, students can meet with state representatives alongside their local pharmacy leaders, and they can spread awareness about the role of pharmacists in the care of patients to our community leaders as well. Student Legislative Day is incredibly important because students are the constituents that your representatives want to hear from. It's important that legislators hear from us to know exactly what we can do and how we are affecting positive change in our communities. Other SSHP chapter opportunities involve getting your school involved with events and initiatives. For example, you can organize advocacy events on campus, and it's always a good idea to reach out to other members of other SSHPs at different schools to see what they've done to increase student advocacy as well. ASHP also has resources and documents on their Grassroots advocacy page where you can find event ideas for advocacy events for students, as well as how-to documents for implementing a policy chair in your SSHP chapter. A policy chair is a great leadership opportunity that also offers students the chance to advocate for pharmacy practice advancement as well.
So far, we have covered some basics on advocacy from a student perspective. As we saw, there are a lot of innovative ways that pharmacists have been incorporated into a variety of practices. The evolution of pharmacy has been made possible through advocacy efforts and is how it will continue to change throughout time. By using our voices, we can continue to advocate to our legislators, pharmacy and non-pharmacy colleagues, and our patients to ultimately advance the future of our profession. So now I would like to introduce Dr. Melanie Dodd, PharmD, PhD, BCPS, FASHP. She's an Associate Dean for Clinical Affairs at the University of New Mexico College of Pharmacy, and she will talk to us further about some of the ways to get involved, current issues, and ways she has remained engaged throughout her career.
Good afternoon, and thank you for inviting me to spend some time with you today talking about my career journey and the importance that advocacy has been throughout my career, and hopefully to, as you will see in some examples, to our overall practice of pharmacy. As the previous presenters shared with us already, they've provided us with some great tips and tools and things to think about. So if you're new to the area of advocacy, these are some great starting points and some great tips that help each of us along the way. And it is true that our legislators love to hear from our students. They continuously ask to have them present and share. So I hope that none of you consider that just because I'm a student, no one wants to hear from you, because that is absolutely not true. What I would like to be able to share with you is a little background in terms of how health policy is developed that impacts us as pharmacists and our overall pharmacy practice, and talk about some more specific examples and some opportunities for you as current student pharmacists and into your future as residents and practicing pharmacists, and how you can shape health policy. So as I start out, I want to go back in time towards the beginning of my career when I first became involved with my state affiliate with the New Mexico Society of Health System Pharmacists. I was a resident at the time, and my residency director invited me to come with her to an education committee for NMSHP. And that was really my first involvement with the state affiliate. While I had been involved as a student in my student society, to really start that engagement at a higher level began, I think, more so as a resident. And we, at the time, were putting into place some new regulations, some new training requirements that involved looking at compounding and sterile preparation training, as well as chemotherapy training, and had the opportunity to then get engaged with our New Mexico Board of Pharmacy through our NMSHP Education Committee. And it was at that time, as we were putting forth new regulations, had the opportunity to be at a hearing for the Board of Pharmacy, and our regulations came up to be heard. And as they were presenting, there came a point where there were some wording changes that I thought should be presented. So I hesitantly raised my hand and made those suggestions, and the regulations were up on the screen as they were being presented, and before I knew it, my words were in regulation. So I was in my early career at that point, and that was kind of my first aha moment that, okay, our words matter, and we can truly make a difference to make better regulations in this case, and to ultimately improve practice. I then later went on, after serving in a variety of roles within my state affiliate, and was elected as president of our New Mexico Society. And it was the first time around when our Centers for Medicare and Medicaid Services, or CMS, was suggesting that they would no longer be able to, or would retract funding for our first year and second year pharmacy residencies. And so at that point had an opportunity to work with ASHP to be able to truly advocate, to be able to put forward a letter to CMS. And that was one of the first times that I had written a letter. And obviously it was not only myself, but it took the nation of all of us as pharmacists with ASHP and our other professional organizations to push forward to ultimately be able to continue that funding for first year residencies. That continues to be an issue, and I share with you here on this slide some recent activity that ASHP is continuing to work on. So Our governmental affairs group throughout ASHP works closely with our state affiliates, and they have done some amazing, powerful things and continue to advocate for us in areas like funding for pharmacy residencies. And you saw in one of the previous slides a long list of issues that they're continuing to advocate for. As I come back closer to home, Troy Lynn mentioned some of the 4 states in our country that currently have advanced practice licenses. New Mexico was the very first state to have an advanced practice license, which we refer to as the Pharmacist Clinician. That went into play in 1993, in which pharmacists are able to prescribe through collaborative practice and have that prescriptive authority for a wide scope of initiatives. That came into play through strong advocacy, through both of our New Mexico Society of Health System Pharmacists as well as our New Mexico Pharmacists Association, working in tandem with other stakeholders. Our New Mexico Medical Society, for example, working with our boards of pharmacy, our boards of medicine, our boards of nursing. So making sure key stakeholders were working together and on board with what we were trying to achieve. In 2001, we also have the ability for pharmacists to have independent prescriptive authority through protocols, which are approved through our 3 boards, the medical board, the board of nursing, and our board of pharmacy. But again, lots of advocacy had to happen in order to get to that point. And I think, a lot of those talking points that helped us to achieve that was, as we speak about the pharmacist clinician, was it really was developed in response to shortages of primary care providers in our very large, geographically speaking state, but a very rural state. New Mexico is the 5th largest state in the country, but we only have a little over 2 million people in our state. So we have some counties that are very, very rural in nature. And we continue to have shortages of primary care providers. So as I mentioned, that legislation was created to push that through in response to that, along with support of our various boards. The Pharmacist Clinician Bill was carried by our New Mexico Speaker of the House. So again, there was another key thing as you think about how do we push forward regulations. Having a person in a key leadership position frequently is to your advantage. So in our case, the Speaker of the House was able to carry this bill forward. We did have to, through our conversations, make sure that all stakeholders were comfortable with this new language. Remembering that this was a brand new concept back in 1993. We did not have the breadth of collaborative practice agreements that we now do in most states today. But one of the things that we included in that language would be that these pharmacist clinicians had to have equivalent training to at least what a physician assistant has. So as a result of that, our requirements for training for pharmacist clinicians is that they have to have a 60-hour physical assessment course and have completed a 150-hour preceptorship before they can become pharmacist clinicians. And then they become registered with both our New Mexico Board of Pharmacy as well as our medical board. For our independent prescriptive authority, again, thinking about what your needs are and how we can improve health and how we can use the skills that we have as pharmacists to address some of those issues that we may have. In our case, as we looked at the independent prescriptive authority, New Mexico ranked at that point near the bottom in immunization rates, especially pediatric immunization rates. And again, bringing coalitions together to be able to support this advocacy. So pulling together our New Mexico Pharmacists Association, our New Mexico Society of Health System Pharmacists, our College of Pharmacy, as well as our boards of pharmacy, And in this case, bringing on board the Department of Health, because they also wanted to be able to advance and improve those immunization rates. The legislation was introduced by a senator who had a close relationship with the New Mexico Medical Society. So relationships matter, and it's important to develop those relationships, as was discussed earlier, in terms of writing letters, scheduling visits, utilizing who you know to be able to support and advocate what you're trying to achieve. Having those elevator conversations to be able to answer some of those questions that were answered. You know, what does a pharmacist do when they're rounding in a hospital? Or what is the role of a pharmacist in the healthcare team? Why do you need to go to school for 4 years to be able to count pills? Well, we know we do much more than that. So to be able to explain those kinds of things to the general public and to be able to have those close relationships becomes imperative, really, to be able to advance the legislation that you may be advocating for. As we look back at our independent prescriptive authority, we started out with immunizations, and we were able to get regulations passed then in conjunction with the 3 boards, the Board of Pharmacy, the Medical Board, and our Nursing Board. And then over time, we've continued to expand our number of protocols that are available in working with those three boards to not only be able to immunize from birth to grave for all immunizations, including we've since expanded to include medications for traveling, as well as several others, for a total of 6 protocols that we now have in place, to include tobacco cessation, naloxone, as well as our most recent being, in addition to emergency contraception, now hormonal contraception. And we also have TB testing, which came at the request of the Department of Health, because there were not enough people that were available to provide TB testing. So they knew what we were able to do with immunizations. They came back in later years to make that request. So again, relationships matter. Other activities that have happened in terms of changes to statutes as a result of barriers to pharmacist prescriptive authority. Sometimes you put into place, in this case, we had our pharmacist clinician as well as our independent prescriptive authority, but you sometimes come to realize that there are components within your state regulations or state law that may be barriers, and sometimes you need to go back and clean some things up. In our case, we had to modify some Department of Health language in 2002, which recognized only physicians as immunizers. So now we had just passed this new law, which allowed pharmacists to be independent prescribers of immunizations, but our state law said only physicians could be immunizers. So obviously we had to again do a little advocacy to amend statute to allow all licensed practitioners to be immunizers, to be able to truly implement that full new law for us. We also in 2007 had to amend some definitions contained within our insurance code, where we looked at definition of basic health services under the HMO law was amended to include services of pharmacists and pharmacist clinicians under medically necessary services. So now our pharmacist services were now included under that definition of what were basic health services to allow inclusion within reimbursement and other opportunities in terms of our health maintenance organizations and insurance plans. And then in 2010, we were able to advocate for recognition of pharmacist clinicians as providers within the Medicaid medical home model trial program. So again, always looking out for opportunities for when our scope of practice is such that we can extend or improve other services that are going on, or as legislation is going on, to be aware of when there are those opportunities to be able to expand our scope. And this was a good example of where they were looking at defining who was going to be included in this trial program for the medical home. and we stepped up. Again, pulling together our Pharmacists Association, our NMSHP, to be able to make that advocacy. I will say we're not always successful, so definitely be prepared to know sometimes we don't achieve what we set out to do. So not all of our initiatives have been successful. We advocated to try to implement prescriptive authority for fluoride treatment. That has not been successful to date. However, with hormonal contraception, the first time around we were not successful, but we came back several years later and were able to be successful that second time around. But I think, again, bringing together who those core people are that need to be at the table to be able to demonstrate not only the skills that we have as pharmacists from an efficacy perspective, but also thinking about safety concerns and thinking about how we fit within our interprofessional teams. And again, usually we're not trying to take things away from other professions. Actually, that's never the case. We are always thinking about added services, thinking about how we can improve overall healthcare. So you don't want people to feel like you're trying to take something away from them either. So I think those are some key talking points as well. So some advice that I would give to you is you think about how can I, as a student or as a soon-to-be pharmacist, how can I be a strong advocate? Well, some advice that I would give you would be, one, as I've given you a couple of examples, think about where there are areas of need. And that may be in a variety of areas. There may be a shortage of healthcare providers in a certain area. There may be legislation that needs to change. We'll talk some about provider status in terms of how we can expand our services. But once you've identified that area of need, think about coalescing some key pharmacy group stakeholders. So not only those that are within your pharmacy groups as you may traditionally think about them, but think about other approaches and other people that are friends of pharmacy, if you will. Also thinking about healthcare groups that may be able to provide them for support. For us, it was involving people like the Department of Health and the other boards, the other medical boards, and having them involved in development of training, writing of protocols. So now they're vested in what you're trying to propose, and they're more likely to speak up on your behalf as a result of that. Definitely identifying effective legislators to help you to introduce legislation is important. You want to have that person that is presenting your bill to be somebody who's respected and hopefully even better, somebody who's in a key leadership position can be even better. And then also determining other statutory changes that might need to be made to enable that advanced practice as you're looking forward to that. So looking to see, are there other barriers? While I might be able to pass this one bill, I've still got some legislative barriers in place that we're going to need to advocate for as well. So now I'd like to switch gears a little bit and talk about obtaining Medicare Part B provider status for pharmacists, which was mentioned earlier. This is still a key area for us as pharmacists as we advance and advocate for federal provider status. And as you may all remember watching as a child, how to become a bill, the cute little cartoon. That's what we're talking about. How do we become a bill? And to be able to push that forward. And that happens not only at the state level, but also happens at our federal level as we push forward. And it truly takes a grassroots effort to be able to advance the practice and to obtain provider status. So we look at some of the barriers to obtaining provider status. We've been on a long journey as we think about provider status to truly move forward in taking that act of Congress. In 2001, Senate Bill 974, also House Bill 2799 was introduced to recognize pharmacists as healthcare providers, but it never went anywhere. Why? Well, there was a Moran Institute cost estimate at the time, which showed the final cost estimate being $427 million with a 10-year estimate of $13 billion with a B. So just due to the pure cost of that bill, it never went anywhere. In 2004, we came back. House Bill 4724, the Medicare Clinical Pharmacist Practitioner Services Coverage Act, again, never went anywhere. We didn't have uniform support from all of our pharmacy organizations, and I think this is another key thing too, is it becomes important that we as pharmacies speak as one voice, that we come together, and that's true at the state level, and it's also true at the federal level, that we need to have that uniform support to have the best success. In 2008, House Bill 5780 was introduced by New Mexico Representative Heather Wilson to recognize pharmacist clinicians as healthcare providers under Medicare B. So we looked at those earlier legislations, and they died primarily because of the extreme cost associated with them. So we said, well, let's take baby steps. Let's look at recognition of pharmacists that have advanced practice licenses. So that would be a limited number of pharmacists, so the cost would come down. So that's where we went with House Bill 5780 and was able to work with Representative Wilson, as well as advocating with our other pharmacy organizations to be able to try to push this bill forward. So working with AACP, NCPA, ASCP, APHA was not in support of this bill because it didn't recognize all pharmacists. So they wanted to have a bill like the previous bills that were introduced that would be recognition of all pharmacists. And ASHP at the time could not voice support for this legislation because at the time ASHP policy number 0318, was in conflict with this bill. So it was now important to now look at, while ASHP in general was in support of the concept, their policy that was in place limited their governmental affairs group as well as us as a whole to be able to support that, because it stated that licensure as a pharmacist being the only state-imposed legal requirement to provide collaborative drug therapy management, which wasn't what this particular bill was asking for. It was focused in on those with advanced practice licenses. So because of that, I wanted, as well as my colleagues, we wanted ASHP to be able to support this bill. ASHP by far is my primary professional home, and I wanted my primary professional organization to be able to support what we were advocating for. So I, along with my colleagues, were on a mission to change ASHP policy 0318. And it was, in many ways, a perfect storm from that perspective in 2008. New Mexico had 3 representatives serving in the ASHP House of Delegates in 2008. We have 2 regular members, and then we had another that was serving on one of our sections as chair. And we were able to introduce a new business item to replace policy 0318 with what later became ASHP policy 0905. But this is another great opportunity for you all to think about how you can become involved in advocacy and changing practice, which is with our ASHP House of Delegates, which is our body of the membership that helps to form policy along with all of our sections and other entities. And I've had the privilege to be able to be a delegate in the House of Delegates for many years now, and it's been a joy to be able to be engaged at that policy level there. So serving on not only as a delegate, as it lined up, I was also at the time serving as a member on the ASHP Council on Public Policy. So that new business item that we had introduced in the House of Delegates went to the Council of Public Policy that same year. So that was where it was referred to be further delineated, and ultimately it came back to the House of Delegates the following year. Meanwhile, ASHP was now able to support House Bill 5780 and subsequent provider status bills as a result of that change in policy. So again, taking those opportunities to get involved with entities like your sections, whether that's your forums as students, new practitioners, as well as your areas. Those are great opportunities to be engaged. If you want to be involved in ASHP policy, running for election to be one of your representatives for your state as a pharmacist, you can then serve within the House of Delegates. So those are fantastic opportunities to really get into the nitty-gritty of some of the policies, which truly do make a difference as we move forward. In 2010, so the previous bill that was introduced by Heather Wilson never made it to committee, never made it to the floor. So coming back in 2010, House Bill 5389 was introduced by Representative Martin Heinrich, again recognizing the pharmacist clinicians as healthcare providers. That particular year, ASHP was the lone national organization to support it. And you know, at some level, maybe you start to get discouraged. You start to feel like Don Quixote, and those windmills are just spinning, and we don't feel like we're going anywhere. But you have to keep the passion up. We know that provider status is important, so we keep moving forward to find the best path with the least amount of barriers to move us forward, which is where we came in 2015, more recently with House Bill 592 and Senate Bill 314, the Pharmacy and Medically Underserved Areas Enhancement Act, which would have recognized all pharmacists as providers under Medicare Part B, based on services authorized by state law in specifically health professional shortage areas, medically underserved areas or medically underserved populations. And this is just a fantastic result of advocacy. House Bill 592 had more than 240 co-sponsors. Senate Bill 314 had more than 50 co-sponsors. More than half of the Senate signed on as a co-sponsor to this bill. In New Mexico, we had our full delegation, all 5 of our congressional delegations, both of our senators and all 3 of our representatives were co-sponsors for this bill. But this didn't happen in isolation. This took all of you and all of us to be able to reach out to our senators, to our representatives as professional organizations, as well as individuals, to be able to advocate for our profession as we move forward. So that required letter writing. That required making phone calls, sending emails, making face-to-face visits when they're home in your home state, or if you have the opportunity to visit them in Washington, D.C. Take advantage of those opportunities when we have bills like this that are important for pharmacy and as important as provider status is, as well as many other issues. They do listen, and you can see that because of our strong advocacy as a profession, as well as having support of our other colleagues, non-pharmacist colleagues, we were able to push forward with a large number of co-sponsors. Unfortunately, it never made it to committee. We came back, reintroduced in 2017 the same bills, and again had a great support, 55 co-sponsors on the Senate side. So again, we had to keep advocating. You've got to keep pushing the envelope. You've got to keep making the calls and keep at it to move forward. So we continue to work on provider status. ASHP and others are looking at some other strategies to try to push forward provider status. And it's going to take all of you and all of us to be able to make that happen. And we will keep fighting for that battle. We've certainly had some successes along the way. If we look at Medicare Part D, our prescription drug coverage under Medicare, when Part D was introduced in 2003 and went into play in 2006, pharmacists, for the first time at a federal level, were recognized as providers of medication therapy management. So we now have the ability to provide MTM services and to be reimbursed under Medicare Part D. And we have specific current procedural terminology billing codes that were made permanent by the American Medical Association CPT editorial panel as of 2008 that are specific for the MTM services that we provide. Again, it took advocacy to make that happen. And now we've got a baseline of saying, okay, we're providers under Part D. Now we just need to get to the point where we can be providers under Medicare Part B as a boy. Some other successes that we've had here more locally, under New Mexico Medicaid, we were able to get recognition under fee-for-service Medicaid for pharmacist clinicians as providers. So again, going back and advocating and using those same tools and those same processes to make that happen. Modification of the insurance and MCO statutes happened in 2007 to include pharmacists and pharmacist clinicians as practitioners and providers. So again, it's looking back at your statutes, looking at your regulations to see where are the gaps and what do we need to improve. We've been able to work with local health plans, which is another great tool as you think about how can we, especially in ambulatory practice, how can we be more involved? How can we be a part of a plan to be a recognized providers? So in some cases, pharmacist clinicians, we've been able to have pharmacist clinicians recognized as providers within local health plans and to put contracts in place. Going through the same medical process that physicians do. So being able to establish credentialing and privileging criteria. So it doesn't always take a law per se or a law change. In this case, it's being able to have conversations with the leadership within health plans to say, okay, where are your gaps in care? How can we support you? And can we be recognized within your plan, or can we set up a contract to be able to push that forward? And then it's understanding what the general medical model is to be able to put pharmacists in those roles. So it's things like making sure you have a national provider identifier number or an NPI number to be able, again, to go through that process. We've definitely, because of all the advocacy that we've been doing, we've had support for the advanced practice pharmacists. We're called out in the Surgeon General report. We're called out in the National Governors Association report, the expanding role of pharmacists in a transformed healthcare system. So sometimes it's being a part of a report, or in this case, it's looking at opportunities to be in the literature, to be in guidelines, to be in a couple of different places which really call out our roles. And those are nice opportunities for us to expand our roles as well. And the last legislative piece that I'd like to conclude with is what has just happened here in the last year in New Mexico, which started in 2019 under New Mexico House Bill 578, the Pharmaceutical Services Reimbursement Parity Act. This bill would require commercial health plans and Medicaid plans, not only fee-for-service, but also our managed Medicaid programs, to reimburse pharmacists for providing medical services within the scope of their license at the same level as other covered providers. So to be reimbursed at the same level as physicians, nurse practitioners, and PAs. We were able to get approval from 2 House subcommittees unanimously, but we ran out of time. We only have a 60-day session in New Mexico in our odd years and a 30-day session in our even years. So in 2019, we had a 60-day session and we just ran out of time. It didn't make it to the floor of the House, nor did it make it to the Senate side. So it died at the end of the session. But we were very excited that we were able to get introduction in our 2020 session, which usually is very focused on things that relate to finance, but we were able to get reintroduction of the same bill, but in this case it was now House Bill 42, again requiring commercial health plans and New Mexico Medicaid of all types programs to reimburse our pharmacist clinicians as well as our pharmacists that have independent prescriptive authority. This was passed in the House and the Senate just in February of 2020. It was signed by the governor in March, and it will be implemented in May of 2020. And we're currently working on operationalizing this bill. It does require a CMS waiver, so we're working with our Human Services Department to make that request with CMS, as well as starting to work with our health plans to be able to implement this bill. And this would not, passage of this bill would not have happened without tremendous support of our colleagues and especially our students. Here I show you just a sample of our phone bank parties that we had with our students advocating for House Bill 42. We had several, and they were calling nonstop. They were sending emails, they were making phone calls. We were making sure we hit every one of our House representatives, every one of our senators, to make sure they knew what House Bill 42 was. And it was to the point where the staff that support these offices began to ask, what is this House Bill 42? Everybody's calling about it. So huge kudos to our students, to our colleagues throughout the state that were able to get passage of this bill, and we're very excited to be able to move forward in implementation of this bill. And hopefully this will then lead on again to federal provider status and the ability for us to be reimbursed under Medicare. But we know that student advocacy works. Here's a picture of our students up at the Rounds House, our Capitol building in Santa Fe, New Mexico, providing healthcare screenings. Another great way to get out there and let the public, and in this case our legislators, know what we do. Our students presented at several House and Senate committees. We were able to push forward some other Practice Act components. We modified the time when our student pharmacists can become interns, such that it was a little easier for them to start May internships. And they were also tremendous advocates for our House Bill 42. And truly, the legislators asked for the students to be there, and they called on them during subcommittee meetings to testify, to really speak to the profession. So continue to advocate and push the profession forward. I think we all have ongoing advocacy. Had the opportunity to work with a couple of my faculty colleagues to be able to publish an op-ed in the Albuquerque Journal in June of 2019. To be able, again, if you have those opportunities to be able to speak to how we can address shortages or other issues where pharmacists can play a role, these are great opportunities to educate the public, our legislators, as to what we can do. setting up those meetings with key stakeholders, as well as champions. Meeting with people like your Human Services Department, had the opportunity to, the immediate past president of the American Medical Association happens to be from Albuquerque, New Mexico, so was able to set up some time with her. So recognizing who your connections can be. Meeting with our UNM Health Sciences leadership, again, to let them know internally within our system. Have had opportunities to meet with Dr. Abramowitz at ASHP to talk about different issues, and continuing to communicate with our sponsor for House Bill 42 as she continues to be a strong advocate for us. But take advantage of who you know, who may be near you, and they likely will be glad to set up some time with you or respond to an email. But take advantage of those opportunities to educate and to continue to push the practice forward and to provide the best patient care that we can. And with that, I look forward to working with our community to advance the practice such that we all can practice to the top of our licenses and provide the best patient care that we can. Thank you again for the invitation to spend some time with you. And again, look forward to interacting with you, and certainly at any time, feel free to reach out to me with any questions in any way that I can support you as we work together. Thank you.
That concludes our webinar. Thank you to ASHP for facilitating this webinar. And on behalf of the student speakers and myself, we just want to give another thank you to Dr. Melanie Dodd for all of the time that she put into this, and just all of the work that she put into helping educate us on her background and just a little bit more of why advocating for the pharmacy profession is so important. Thank you.